First of all, I would like to thank with the A-PSDE to let me share about finding your way to the anatomy linear EUS. Okay, this is my way. Linear EUS is start from the Nagoya, Japan, about 10 years ago. Okay, this is my first professor. This is Professor Hara from the Aichi Cancer Center, who teach me about the linear EUS. And this is Professor Ono from the Nagoya University, who teach me about the radial EUS in 10 years ago. So this is my pleasure to share about my way to do the EUS to everyone. The basic station in the linear EUS, we have 3 stations. The first station is the stomach station. The second station is duodenal bowel. The third station is the second portion. As you know about the stomach station is the most important because you can see about 70% of the EUS finding. Let you see from this slide. In the stomach, we have two stations. This is the first is the cardia, and the second is the lower body. If you push the endoscope to the lower cardia here, you will see in the liver, portal vein, bile duct, and some part of the pancreas. Okay, why EUS is so difficult compared to the gastroscopy? If you know about you learn study from the gastroscopy, you push the endoscope to the esophagus, you know about next step you put to the stomach, and the next step you put to the duodenum. But it's quite different with the EUS study because you not know about how you can go to the next station, right? So could you please remember about the station in the stomach? The first station I recommend to start with this one. You have to know about this picture. This picture is the S2 is mean the left lobe of the liver is segment 2 and this is segment 3 and this is a left hepatic vein. Please remember this picture in first station. And you have to know about the second station. The second station, I will show you how to find the first station first. This is first step, okay? You push the endoscope in this position, in the patient in left lateral position. You put the endoscope into the gastric cardia, okay? And big wheel up and keep suction, okay? You will see this picture. This picture is, as I told you, this is the left lobe of the liver, segment 2, segment 3, and left hepatic vein, okay? After that, you go to the second station. You just clockwise rotation. See, clockwise rotation slowly. You will see the second station. This is umbilical portion. And you slowly clockwise rotation. Slowly clockwise rotation, you will see the middle hepatic vein go into the IVC. Because this is look like the elephant head. And slowly clockwise rotation more. From this picture is go to this picture. This is the portal vein and the common bile duct. It look like the chopstick. It's between it's parallel for the portal vein and the common bile duct. Right now, your position of the scope is like this. From counterclockwise and slowly clockwise rotation. Okay. From this picture is go to this picture is a station 5 is a aorta, celiac, and SMA. Right now we show you about the picture you have to remember. Okay. This is the first, second, third, and fourth, and fifth. This is just the maneuver just the clockwise rotation in the cardiac, you will see all of this picture. Let's show the video. Okay, this is the first station, segment 2, segment 3, and middle hepatic vein. Okay, and you clockwise rotation more, you will see the umbilical portion here. This is second station. Okay, this is second station. Just clockwise, clockwise, and clockwise. This is the elephant head. Middle hepatic vein going to the IVC. And clockwise rotation more. You will see this is portal vein and the CBD is below. This is the fourth station. And if you clockwise more, you will see the fifth station, the aorta, celiac, and SMA. Okay, let me show you again in this picture. Please connect the dot from 1, 2, 3, 4, 5. Okay, start from this position. Okay, let's see the video again. Okay, this is first station. You have to remember this picture, and this is second station. This is umbilical portion. Clockwise rotation more. You will see the third station is here, the middle hepatic vein and IVC, and the fourth station, portal vein and CBD. Okay. See, this is middle hepatic vein into IVC. This is IVC and aorta. Is that all in the gastric cardia? Okay. And next, this is finished in the gastric cardia. So we go to the lower body of the stomach. In the lower body, you will see the portal conference in the first station. And the last station is in the spleen. Okay. This is the first station in the lower body of the stomach. You have to remember this picture. This is portal vein, sphenic vein, and the SMV. This is called the portal conference from endoscope in this picture. And again, you go to from number 1 station to number 4 station to look at the endoscope moving like this. Okay, you will change the picture from here to the spleen by clockwise rotation. Okay, if you look at in this image, this is a EUS mind map. You have to remember also this one. Go to first station to fourth station. Okay, see the endoscope moving like this, and your maneuver is just from here to here. Clockwise rotation. Go from body of pancreas to tail of the pancreas. Okay, see this picture. Number 1, number 2, number 3, and number 4. Okay, right now, see the video. This is the pancreatic body. This is portal conference. This is pancreatic duct. Okay, you just move from the first station to second station. This is, in this case, we have a pancreatic cyst, and this is body of the pancreas. Just slowly clockwise rotation. Okay, slowly keep the target organ in the 6 o'clock. Slowly go. This is left kidney, and this is the spleen in the last station, and this is tail of the pancreas. Okay. Okay. Right now, finish in the stomach station. If you know about the stomach station, you can do the EUS about 70% of the imaging. So now we go into the duodenal bowel, like the ERCP technique is from the here to here. Put the echo endoscope in duodenal bowel. From this picture, you will see the bile duct is very near to the echo endoscope, and portal vein is a little bit far. Okay. From this position, you have 3 stations. The first station, if you put the echo endoscope in and counterclockwise rotation like this, you will see the gallbladder and the liver. Okay. If you slowly clockwise rotation from this picture, you will see the bile duct is nearby here, and portal vein is here. And you clockwise rotation more here. You will see the ampulla and head of pancreas, pancreatic duct, and CVD. Okay. Now, again, clockwise rotation from 1 station, 2 station, and 3 station. From the gallbladder and the liver, clockwise rotation, slowly you will see the common bile duct and portal vein. And clockwise rotation again, you will see the papilla and ampulla here. The scope and maneuver is here, here, and here. Now see the video of the duodenal bowel. Okay, you see this is the first station. The maneuver is clockwise rotation slowly. You will see the bile duct and portal vein. Okay, and you clockwise rotation more, you will see the papilla is here. Okay. Now is the last station in the second portion. This is represent only about 10% of the echo endoscope imaging. From the last station, the procedure is the same with the ERCP. You push the echo endoscope into the second part position and short the endoscope a little bit. The scope is going into the third part duodenum. In the third part duodenum, you will see the IVC and the aorta. Okay. After you see IVC and aorta, you just slowly pull back and clockwise rotation. The echo endoscope is like this. The position is like this. You will see the IVC, aorta, common bile duct, pancreatic duct, pancreatic head, and SMV, SMA is just below the pancreatic parenchyma. Like this. If you pull back from third part duodenum to second part duodenum, you will see the bile duct and pancreatic duct. Let me show the video. This is the echo endoscope in the third part duodenum, and you just slowly pull back and clockwise rotation. Okay, you will see this is a bile duct and pancreatic duct is below. This is the area of the head pancreas, and you will see the SMV and SMA is just below the pancreatic parenchyma. Okay. Okay, again, this is aorta, pancreatic duct, and CBD. Okay, this is a EUS mind map. You have to remember about this is the echo endoscope imaging in your mind. You know this one, you can go to from the pancreatic body to pancreatic tail. This is a duodenal bowel station. You know, this is the liver on the right, on the upper part of the echo endoscope, and in the lower part is the pancreatic head or the ampulla. And this is a EUS mind map in the second part duodenum. You go to third part duodenum, see IVC and aorta, slowly clockwise and pull back. You will see the bile duct and pancreatic duct and pancreatic head portion. Okay, and when you do the EUS, please always keep your suction because this air is enemy of your echo endoscope imaging. And you be not used in the endoscopic view. We have to use the EUS mind map in your mind to get the station by station, and follow your mind map, EUS mind map. You will get the best imaging of the EUS. Okay, thank you for your attention.
Thank you very much, Dr. Siripun, for your nice and detailed lecture. So, is there any question from participants? So, I think that it's very difficult for the beginner to learn EUS linear. And how about your tip and tricks to your advice to the beginner to do linear EUS?
I agree with you in the linear EUS. It's quite difficult when we get to start to do the echo endoscope because it's we not know how we can go and what is the picture we have to do. In my opinion, if possible, you should attend with the expert in your local hospital to see how the expert do the echo endoscope and learn with him as much as possible, especially the imaging of the echo endoscope step by step, and start with the stomach station to do as I teach you about the imaging, the station by station under professor suggestion.
So I think the most important thing is that we have to remember the anatomy of the biliary pancreatic system.
Exactly.
Yes, and the second one is that if you lose the weight, you have to go back to the landmass and you trace to the next dot by dot, like Dr. Aroon said. And the third one is that we have to have the systemically scanning to prevent the missing the lesion. So I think that's a very important thing in the beginning.
I agree with you.
So, are there any questions? In the second part of duodenum, in the duodenum station, you prefer using the water fill method or such a or no water methods?
In general, we not use the water even in the second part duodenum, but in some case the water is much more helpful, especially in the ampulla lesion. In the ampulla lesion, sometimes the water can see clearly in the tumor very small in the ampulla. If you flush the water and keep suction in the air out, you will see more clearly, especially in the ampulla area. Or sometimes we do the submucosal tumor in the second part duodenum, we have to use the water as well.
No more question now. Okay, thank you very much.
You're welcome. You're welcome. You're welcome.
So now we finished the 3 lectures this morning. So it's time to close today's webinar. We have a very informative lecture from A-PSDE faculties, and I hope that I think that we have learned a lot about ERCP and EUS procedure. Again, I would like to say thank you to Professor Kida, Dr. Siripun, Dr. Siripun for your lecture today. Thank you very much, Professor Kitano, for the support. I would like to say to thank Dr. Phương and Cancer General Hospital for helping us to hold this workshop. My thanks to Olympus Company. And I would like to close this morning webinar session. And we also have the ERCP EUS light K in the afternoon, only for the local training doctors. Thank you very much, and bye-bye. See you again.